Thank you very much for your question. I have to say first that the data that we have on liquid biopsy are very exciting, but not yet ready or enough to transfer readily and nowadays this technology in the clinic. So this still remains in lymphomas a research essay, but the aim of course is generate more data to really identify where it can be useful for the patient management. Based on the information that we have today, we can say that it may effectively profile, so gene identification. So if you want to identify a gene mutation, you can do it on liquid biopsy. And it may help in interpreting better the results of PET scan after therapy. These are cornerstones that we know. How to use this information, less clear, and so far no recommendation in guidelines to use ctDNA in practice. Yeah, I think that before implementing in the clinical practice ctDNA technologies for lymphomas, we need to standardize and harmonize the technology we use to assess this matter, because many different centers use many different approaches, and so I don't know actually whether the results could be the same if we share the same sample across the centers. This is an effort that we have to do to convince the community, the clinicians, who may not be so deep into the technicalities, that the results of our assay are good enough to be used in the patient. So harmonization and standardization is a missing step before launching in the community this, because ctDNA, as you were mentioning, is a difficult type of DNA and needs careful assays, a careful design of assay for being detected and measured. Well, for the technology, I think that CAP-seq, the method that we use, and that other centers in the US, in Europe, and also in China are using, is the one that is more consistent across the community. So this might be a first way to proceed. It is not a commercial assay, it is a custom academic diagnostic approach, and this has the value that we know what we are doing and we know how it performs, we know the limitation and the pros and cons. That's the first aspect. I think that it's important to really have the feeling from the community of hematologists, where they see the value for patients in ctDNA. As I mentioned before, last year during the Lugano conference, the feeling of the community was that we are not ready for this in the practice or in the guidelines, but there is an ongoing discussion, and we will see whether with more data next year in the Lugano meeting of lymphomas, the people has changed their mind and may be redirected to at least suggest to implement this in every clinical trial to gather more information.
Thanks so much. We're looking forward.
Thank you.
Thank you.